And I think I've been again, as a part of the NHS, I've been given this lady called Kate Moody, who is fabulous. She is what I call sort of my probation officer. I can phone her at any time.
Yes.
She comes to me with all the appointments, but really her job is when I'm feeling down, she phones me, and what I get secured by are the processes to make sure that I'm not slipping through the net. So she tells me about those, and I very rarely phone her now, but in the early days I used to phone her quite a bit, and I could ask her questions and she'd tell me the right answers.
So you're talking about your clinical nurse specialist allocated from your team?
That's right.
Yeah.
I was very surprised that at the beginning of the journey, I thought it was lip service, because a lady came in and she gave me a business card and she said, hi, I'm Kate and I will be with you through your journey. And I thought, that's a lovely gesture, but I didn't think that it would happen. And it did, because every time that I've phoned the office or phoned her number, she's answered. She remembers me, I think, unless she's brilliant at it. I know now that she does remember me, but even in the early days, she seems to remember me. She has obviously got access to the computer, so the things I was always started off the conversation was about, just remind me about the last blood test and what the figures showed, and then I'd tell her the real reason why I'd phoned up. So I'd use it to, I'm just phoning you up about when my next appointment is, and then I'd start to talk about her honestly, and she knew that's what I think other people have different approaches, but she's been there every step of the way, and I like the idea that if I phoned her now, she'd answer the phone and she'd tell me something sensible.
So having that consistent person who's on your side, who knows your information, is in a trusted position, that can be really valuable in seeing you through the cancer journey.
Unbelievably useful. I changed consultants. My oncologist decided to have a career change and has moved across to children, and so I was presented with a new chap, and our first interaction with each other was a bit abrasive because of my part. And when he said, oh, you're here for your 9-month check, I said, no, I'm here for my 6-month check. Instantly, I felt, well, you don't know me. And unfortunately, with Kate sat there, he'd said something extremely sensible, and he was a consultant oncologist, the people that are meant to know everything. And I had that good relationship with Kate. I looked across at Kate and said, what do you think about what he said? Do you think it's right? Should we do that? Which obviously put Kate in a very difficult position, because she's the clinical nurse specialist with a consultant, and she's gone, yes, he's absolutely right. And so I didn't do my relationship with the oncologist probably any good, asking the nurse to say, should I trust in him? And obviously we've developed our relationship since then, and I get on really well with him now.
But that just shows you, it's not just the medics who are valuable in the NHS. It's definitely multidisciplinary, and often the nurses and other allied health professionals have unbelievable expertise in their area, and they often have a bit more time to spend with you on a personal level. And that can be really one of the most important things, knowing somebody's there in the background, even if they're not on the phone to you all the time. It's just reassuring to know you can contact them when you need them.
Well, that's the thing about going to see your oncologist. You have a 15 or 20 or 30-minute appointment, and they always seem to be that they took exactly the amount of time that I needed, not according to the clock. But we'd go in with a list of questions, and having a list of questions is a great thing, because mine just went blank going, am I dying, doctor? And then I couldn't remember any of the questions. And that opportunity with Kate was the fact that instead of having a list of 20 questions and then just keep firing at the doctor, which is, I took my wife and I said, she wrote down the questions, and I think it's a sensible thing. Having access to Kate, I could ask that one question, phone up, and she'd answer it, and I'd put the phone down, job done, and I'd feel secure then for the rest of my time, knowing that I had the answer.
Wow, that's good.